Hello and welcome to this webinar about transforming consent with Concentric. So to do some quick introductions to who's running the webinar, I'm Dav and I've got with me Ed, who's Chief Medical Officer at Concentric. So I'm a surgeon by training and for the last few years have done a variety of things in informatics and health technology, and I'm really pleased to have had the opportunity over the last 18 months or so to take Concentric on as a project that both Ed and I had been really interested in the consent and shared decision making space for a number of years, and following an Innovate UK grant we're given an opportunity to really run with this and solve the consent problem for us all. Ed, if you'd like to introduce yourself.
Hello, hi, I'm Ed. I'm the Chief Medical Officer at Concentric. I'm just starting a consultant post at the Royal Marsden. I'm a breast surgeon by training, and have just implemented Concentric at Imperial, so I'll talk to you a bit about my experience there. But I've been passionate about consent and improving how we consent for the last 10 years, really, and this is a culmination of our endeavours to do that.
So what we're going to do today is to introduce to you Concentric, which is our digital consent application. We'll go into a bit more detail and share a demo with you, but essentially this is an application which means that you can have a fully digital and remote consent process where remote is appropriate, and makes it really, really easy to share personalised information with patients in a really accessible manner so that we can all drive towards informed shared decisions. So over the next 45 minutes or so during this webinar, what we're going to do is to outline why transforming consent is important initially. We're then going to walk through a video demo of the Concentric application before exploring both patient and clinician experiences of using Concentric. We're going to spend about half an hour going through that and then have the last 15 minutes for Q&As. So please do submit any questions during the webinar. So to go through why consent is important. So consent for treatment is a key element of care. So in terms of quality of decision making, experiences of patient-centered care and organisational medical legal risk. And there's been a couple of things over the last few years that have brought consent really to the forefront. So the Montgomery judgment, which many of us will have heard of, was a Supreme Court case back in 2015. And the important things that came out of that were, moving the consent process from a clinician-driven process to that of a patient-centered process. Really, that was about saying, this should be personal to each individual, and should focus on what matters to that individual. So introduce the concept of material risks. There have been some other legal cases in the kind of interim period, but another that really came to the forefront earlier this year was the Patterson inquiry, and that really hammered home some of the requirements around patients having time to consider their treatment options, making that information really accessible, and having a documented process so that you could see the journey. That this isn't just a paper form, a carbon copy paper form which has some medical jargon on it. It's a process, a documented process where you can see, actually, yes, this patient has had this information, they've been able to engage with it, they've engaged it in a certain way, and they've had time to consider to get to a point where it's a truly informed shared decision. So both us and other teams have really shown over the last few years that the paper consent process is just not fit for purpose. And this will be of no surprise to you, but these paper forms show huge amounts of inappropriate variation. They are littered with errors. They are usually legible, and often these kind of key documents are lost. From a patient's perspective, there's a lot of medical jargon without the context to really understand those terms, and helping patients to reflect on that terminology, and what that might mean for them. And even down to the fact that these are still carbon copy forms in what is otherwise an increasingly digital world. And what we're seeing, certainly with the interest that we're seeing over the last couple of months, is that this process is just no longer compatible with a kind of post-COVID healthcare system. We're requiring patients to undergo pre-treatment isolation rather than coming in for for a consent consultation purely to sign a paper consent form. And more, as we all know, we're moving towards remote consultations, and so anything that's tied to paper processes mean that that's increasingly difficult. And for us and all of us, that's an opportunity to say, okay, we knew there were benefits in terms of these digital processes, but we were just about managing to continue with this paper process. Actually, remote says, well, that paper process no longer works. So let's use that as an opportunity to realize all the other benefits of digital. So just to summarize that, over the last 18 months or so, we've been getting the Concentric application ready. Ed will talk a little bit about what that has looked like in terms of our initial deployment at Imperial, and then we can talk maybe a little bit in the Q&A sessions about the other places that have gone live over the last couple of months. But this is a digital remote consent application, really intuitive. It feels like something that you would use outside of healthcare in your other day-to-day life rather than some of the other healthcare systems that we use. Really easy to share personalized information, evidence-based information to get to that ultimate goal that we all are striving towards, is that each of our patients is making informed, shared decisions around what matters to them. The benefits are really shared between patients, clinicians and organisations. So clearly, particularly of importance at the moment, it's enabling remote consent consultations and documentation of that consent. But really, one of the key things, and why Ed and I are so passionate about this solution and about this problem, is that it supports patients to engage with, understand and own decisions about their care. And from a clinician's perspective and an organisation perspective, digital and Concentric makes it really, really easy to get rid of all those errors in the paper process, and gives you a standard kind of starting point to remove that inappropriate variation, and clears a huge amount of that legal risk. So what I'm going to do now is to share a demo of the application from a sort of clinician's perspective, but also shows the patient-facing sides.
Hi, I'm Dan from Concentric Health. This short video is a demonstration of the Concentric Digital Consent application for clinician users. To start, simply go to Concentric in your browser and log in. This can be done from any device, including your personal devices. I'm using a demonstration version of the application, so no real patient data is shown. From the home page, you can search for a patient and see recent consent episodes. Let's search for a patient. Here we see any previous consent episodes for this patient. To start a new episode, click the big plus button. I can search across the Concentric ontology, across over 1,000 procedures, including using acronyms to find the right procedure quickly. In the clinician view, I can select the information that is relevant to the patient, supported by suggestions by the Concentric ontology. This includes indications, alternatives, anaesthetic options, risk profile, and additional patient information. Each field can easily be made bespoke for the individual, for example, adding a bespoke risk, as shown. We work with clinicians from each healthcare organisation to ensure that the information is appropriate for the local context. At this point, the information is ready to be shared with your patient in the consult view. Consult view facilitates a consent consultation between you and your patient. Lay language is used to describe terms, and trusted sources of additional information are shared. Information regarding indications, purposes, and alternative options are shared on this first page. For many patients, their anaesthetic plan is an area of uncertainty. On this page, we can share at a high level what the plan will be and signpost the sources of information, such as this video about having a general anaesthetic. Whilst on a paper consent form, the risks of surgery are often a long list of medical terms. With Concentric, we can support patients to reflect on each potential complication, including when they may occur, how likely it is to happen, and what it might mean for them. Where a particular conversation has been had around a risk, notes can be added to document the conversation. Additional information can be shared with patients and may include information from national bodies, patient videos, and information about attending your healthcare facilities. Depending on the individual circumstance, you may wish to simply share the information with your patient, allow them to sign their consent later, having considered the information, or sign with you in your clinic or on the ward. Concentric facilitates all these options. I'll show the remote consent options in a moment. For now, let's proceed to give consent. Here, the patient is asked to confirm that they understand what is being proposed and can be asked regarding any additional consent, such as for a blood transfusion in this example. The patient can then sign on the device, or if easier, can transfer to another touchscreen device via a secure code. So that patients can access their information, their email is added. Where an email is not available, patients can receive a printout of their bespoke information. When consent has been given, the key information is presented as a summary and can be used initially to confirm consent and then during a surgical safety check in theatre. The completed consent form can be automatically sent to the patient's record in the organisation's electronic health record. There are scenarios where remote consent is beneficial, both allowing patients time to consider their information and reducing the need for physical outpatient appointments. To enable remote consent after a physical consultation, simply state that the patient is not ready to consent yet and enable remote consent here. Remote consent can also be enabled by clicking the action button in clinician view, for example, following a video consultation. The patient then receives an email and enter their date of birth to access their information. This contains the information shared, including recommended resources and consultation notes. Where remote consent has been enabled, this can be completed and is then visible within the clinician's application. If you have any queries regarding any of the functionality, would like to know more, or have any feedback for us, we'd love to hear from you.
Okay, so that walks through how this process works. That's an example in kind of a surgical scenario, but actually a number of our recent deployments have been in oncology, so kind of treatments are just going live in our first dental practice, and there's a number of you on the call on this webinar from primary care, and so actually we feel that that translates quite nicely over to primary care, and so very keen to have those conversations. So now let's go through a few questions, Ed, with yourself about your experience. So just for the group, describe how you've been using Concentric in your practice.
Yeah, sure. Well, so we started using Concentric at Imperial initially in breast surgery. So I'm a breast surgeon back end of March, really, and really have switched over to using Concentric exclusively for the patients I consented, and the rest of the team too. It enabled us to consent patients in a sort of variety of different methods. So it allows you to consent patients in clinic, and you can go through all the information with them. and then you can either sign it with a touchscreen device. I've used my own phone for some patients in the COVID setting. I've asked them to put on a pair of nitrile gloves to sign on my phone, and that's been fine. Or they can use their own phone if they have it, and that works very well. Or indeed, you can email it to them and they can complete the consent form and sign it in the comfort of their own home. So I've found all of those processes work really well. I've also been using it virtually. So I'd phone up a patient who'd been on our waiting list, perhaps longer than otherwise they would have been because of COVID. And then I'd talk them through their decisions and treatment options and then proceed to consent them over the phone by talking them through it. And the really nice thing about that is I could then, I would send them an email to their consent sort of portal, and I'd be able to talk them through it in real time, explaining what we're doing, why, what the alternatives are, and what the risks were, particularly also covering the COVID related risks, and get them to sign it. And that all worked incredibly well. It points to multimedia information. So for the breast cancer, we point a lot of our information to the Breast Cancer Now information, and that the patients have really enjoyed having that. And of course, that's information that we traditionally used to give via paper, via the breast care nurses. But when these patients have been at home waiting on a waiting list, they haven't necessarily had these leaflets. So rather than having to send them all by paper in the post, having easy access to them have been really helpful for the patients. And from my point of view, it's really reassuring to know that they do have all the information, particularly in these uncertain times, that they actually have transparency about what option they've decided on and what the risks and benefits are. And then I guess finally, we've been using it fully paperless. So at Imperial, we've actually done a full integration into the Cerner system. So the consent form drops into their electronic healthcare record. So there's visible to anyone in the trust. Also searching for patients, it searches through the Imperial database. So it's a completely seamless system. And that means that it's paperless right up until, well, throughout the process. And with the WHO checklist, we'd bring up the consent forms within the electronic healthcare record system, and we wouldn't need any paper at all. And that's been a real game changer in these difficult times. And from there, we've now expanded out to starting to be used in all other departments at Imperial. But that's my experience so far.
Great. And so, what would you say have been the most kind of notable impacts for you in terms of the experience, both for you and your patients?
Well, I think first and foremost, ensuring that all the information is there. So I've done a fair amount of work looking at how clinicians fill out the paper-based consent forms. Some of it's published and some of it's due to be published imminently, but it probably won't surprise the listeners to know that the error rates on the paper consent forms are vast. There's people forgetting, the clinicians forgetting to put risks on, I think by errors of omission, by mistake. And there's illegibility, and then there's just forgetting to fill a particular form field. And certainly in our data, that's over 50% of forms had one of those errors. And so for me, knowing in these sort of busy times that I have mentioned all the risks that I do need to mention, and more to the point, know that it's written in lay information so the patients can understand it and can go back in and have a look at it sort of later down the line, that's very reassuring to me. And I think it does really help me feel the patients engaging in this decision. I think particularly during COVID, having all the COVID risks there is very important, because it is an uncertain time that we're operating in, and it is a shared decision that we make together with our patients. And so that I think is very crucial. And I think divorcing those two parts of the process, having COVID risks and then a paper-based consent for the procedure as separate things, doesn't make a lot of sense, because actually they're all intertwined together. So that's been really helpful. I think going paperless has also been really helpful. We've had consent forms that we've done in advance before the day of surgery go missing, and that causes delay, and having to redo those is very frustrating. So having it all visible, everyone can see it on the electronic healthcare record system, that's been hugely helpful.
Right, and you've touched on kind of the impact of COVID there. So where would you see the consent process kind of fitting into treatment pathways, I suppose, in the short and the medium term?
Well, the Royal College of Surgeons has recently published some guidance about consent to treatment during COVID. That came out, I think, last week. And in particular, it talks about discussing the risks of COVID. It talks about the fact that it's totally acceptable to have remote solutions and be able to send consent forms electronically. And so I think electronic consent or digital consent makes total sense, and I think it's here to stay. I think Patterson inquiry really made it clear that people need time to consider. And there's been some Supreme Court cases, Thefelt versus Johnson, which reiterate that. And so I think it's no longer acceptable to just assume people will turn up on the day of surgery and then sign their consent forms on the day. We must move away from that. So I think, number one, I think consent will have to be and should be done in advance where possible, and that's obviously for elective procedures, maybe not necessarily for emergency procedures, but where possible, giving patients as much time to reflect and consider their treatment options. And the Royal College of Surgeons have said that digital consent is fine, and I think the NHS long-term vision is for us to all go digital by sort of 2023, which is ambitious, but the drive is certainly towards going paperless. And I think the final thing is, I think COVID has changed things. I think we're now doing more telephone consultations, video consultations. I think patients no longer expect to come to the hospital, to pay for parking, to wait hours in a busy waiting room, when they can sit at home and have an easy consultation in comfort from their home via telephone or video. And I think now they've tasted that will be demanded more. And certainly the feedback I'm getting from a lot of our patients is they love having this ability to be consented without having to come back physically into the hospital. So I think all of these things are here to stay for the long term.
So I'm seeing a number of attendees from kind of primary care settings. So how do you see Concentric helping in primary care?
Well, I think the first thing to say is well known that the primary care setting really have nailed shared decision making very well, and perhaps much more so than we have done in secondary care. And I think part of that is because in primary care you've got the ability to really know and understand the needs of your patients. You know whether they go gardening 5 times a week and being able to kneel down to cut the roses is important, whereas the orthopedic surgeon who's discussing a hip operation may not know the minutiae of that. And so what we're trying to do is really empower patients and bring that sort of shared decision to the forefront. And we're very keen to sort of work with primary care to allow that. But I think in terms of how this can be immediately useful for primary care, there are a few things that were helpful. Firstly, for minor ops lists, anyone doing minor surgeries that are currently using consent forms, this is good to go. We can run a non-integrated approach and have people signed up really very rapidly within a week or so. We've got a huge database pan surgery of procedures, so anyone in primary care that is thinking they would want to give this a try could really start doing that immediately. Other things to say is long-acting contraceptives. It's quite typical that primary practice require written consent when they're doing implants or coils, and again, this lends itself very easily to do this on our system. And then just other examples: the Prevent Pregnancy program that requires those patients on sodium valproate of childbearing age to sign a consent form to say they understand the risks of the tetragenicity of becoming pregnant whilst on that. Again, we can outline these things on our consent system. So essentially, wherever a consent is performed in primary practice, we're able to facilitate that. So do get in touch with us, and we'd love to help you with that.
Do you want to take us through some kind of initial service evaluation data from Imperial, initially from a clinician's perspective?
Yes, so this is from the clinician. So I think the first thing to say, of all the patients we've surveyed, and this is actually looking at the breast department, every single one said that this the Concentric system gave much better. It was a much better process. It supported the patients through the consent process much better. People were more informed, with a very high score there, right up at the top. I think 4.75 out of 5 was the average score for that. Again, for the clinicians using consent in the department, we looked at paper consent and the Concentric process, and filling out the Concentric form was at least twice as quick. It got even quicker if you were doing it on an iPad that was sort of preloaded. But I'm wary of saying that we're trying to speed up the consent process, because we're not actually. We're trying to make patients feel better informed. But the point is, we're trying to take out the administration of handwriting a paper consent form, and therefore give more time to the clinician to spend explaining that information back to the patient. So although I'm not entirely sure that our aim is to make the consent process overall quicker, it's certainly to make filling out the form much quicker so that we can focus on explaining it to the patients.
Great. So the next few minutes, we're going to look at a patient experience. So this is actually a video that was recorded by Ed with a patient from Imperial who has given consent to this video being shared with this audience.
Just a little explanation. She's 75 and has breast cancer. If we just think, when I first phoned you up and said we are going to be doing this consent process over the phone, how did that make you feel initially?
I was pleased not to go to the hospital for travel reasons.
Signing the consent form at home on your own, I think you used your iPad. Yes. How did that work for you?
I'm used to signing electronic devices, so that was not a problem signing it.
In terms of the content that we went through in the consent form, what did you think about that? Was it easy to understand, and did it make sense? And was it the right sort of amount or not enough?
I just found it straightforward and easy. There was nothing that I remember having to ask you about. And I did have it in front of me, so I could have reread it if I was in doubt or confused.
And do you think it felt personalised to you?
Oh, absolutely. And the reason is that it was about, you know, the particular surgery I needed for the tumour in my breast. It had the alternatives I already knew about, so that was confirming something that I'd already looked up myself and discussed with your colleagues at the hospital. So, yes, there was nothing on it that left me feeling that this was a template, and I was being asked to answer questions that are utterly irrelevant to me. And one meets that a lot. This did not have that characteristic.
Okay, that's nice to hear. And was the technology sort of intuitive and easy to use? Did it sort of work for you?
I've been using this type of technology since the 80s, when it first was starting to be used. So, and I've grown old with it. It was very straightforward.
Now, you've had some experience of having procedures using the, I guess, the more traditional consenting process, where we do it on paper and we sign it with you in person. How, comparing the two together, are there any reflections on that?
Yes, and my experience with the paper forms is now some years ago. I suppose in trying to recall it, there are two things that I remember. I think in one surgery, I was signing actually just before the surgery or in the surgery, and I think I remember that afterwards I thought that I hadn't a clue what was going on. My concentration was certainly not on signing forms. So that's one incident. The other incident, I think I was just given the form, told to read it, which I did. And my recollection about that is it's actually quite hard to read and absorb something when there's someone else waiting for you to finish reading. So if I take those two experiences and compare them with, you know, sitting at home in my own chair and signing, the signing at home was considerably more comfortable for me. And no, there was no, I felt no pressure. I think it was also done a little earlier than I've had it done before. And that was, on reflection, I think that was actually quite good, because I had time to reflect on the fact that I had consented. I knew what I'd consented to. I went back and read the form again. And so I knew what was going to happen in advance and had time to think it through.
So you said you went back and looked through it again. Was it quite straightforward to access that, to get back into that?
There's something that it just says, no, click on this to read it again or something. I can't remember what it was, but it was, as far as I remember, it was one click and there it all was, including an odd looking signature.
Good. So overall, do you think it sort of helped support your treatment decision, doing in advance and having the information?
It confirmed it in my own mind, absolutely clearly. It was part of the support. The rest of the support is the discussion with other of your colleagues.
Yes.
And my own reading. And of course, every single one of us goes rushing to Dr. Google immediately to find out as much as one can.
Yeah. So the paperless feature of it was a significant advantage in your eyes.
Oh, it is to me, yes.
Okay.
And I'm used to keeping things electronically now. But I have to say that has to be true for most of the population. If at my age I am, then everyone younger than me certainly is.
Great, and real thanks to that patient for giving her time to do that. And Ed, back to you just to walk through some of that service evaluation at Imperial from a patient's perspective.
Yeah, so again, during these last few months, we've been asking our patients what they've thought of the process, and the feedback has been altogether fantastic, really. They've been filling out these surveys anonymously without anyone looking over their shoulders, so they really could say what they felt. But asked 3 questions in particular. Was the content easy to understand? Did the information cover things you felt you needed to know? Did it support your treatment decisions? And of all of those, 100% of the patients asked said yes, with no one saying no. In terms of patient feedback, some fantastic comments we've had. We've had Concentric is an excellent system that ensures important information is gathered in a timely manner. It speeds up the overall process of patient consent. It is one of the most sensible and logical processes used. It's 100% highly recommended, very good and easy to use. The process was easy both at the time and later when I could return to the form to review. It was comfortable to do this from my home by telephone. It helped in pacing the questions at my speed. Other people saying it's good to have the information. And yeah, excellent to have all the relevant information in one place, easy reference, and the surgeon gave lots of time to answer questions and explain things. So I think really what we're hearing is very positive news about this, and I think rightly so, because compared to how we've been consenting previously, this really does give the patient a lot more information at their fingertips, bespoke to their procedure done for them. And so far, very positive.
So what I'd like to do now is to go through into some question and answers. Unfortunately, I'm actually going to have to leave in a minute or two, so I'm going to leave you in Ed's capable hands. So, Jamie, do you want to take this over from me?
I will. Thank you very much, Ed, and thank you very much, Daff, for doing that. I've got some questions here, actually. Ed, I'm not sure if you can see my screen. You might be able to see those questions there, some of which you've actually covered off, but if there's any that you wish to pick in a particular order, then by all means go ahead. Otherwise, I'll just sort of lead from the top, the 3 questions that have come through.
Just before Daff goes, then maybe start with that one about the date of birth.
Yeah, so the approach here is that patients get a secure link to their email, so that has an unguessable link that they follow, and in terms of someone kind of searching links to find one that works, that's a base 32, 10 to the power of 16 different link combinations, and the landing page doesn't give you any kind of insight whether that's a genuine link or not. And so that's the kind of first part, and then the second factor authors is a date of birth. So we've worked with a number of the NHS trusts in terms of that approach, and are live with that approach in a number of trusts and health boards, both in the UK and elsewhere. You ask about NHS login, so actually we're very interested in working with that, and NHS login are widening access to that API, and so that's certainly on the roadmap. I'm very keen to do so. It just hasn't we haven't got to that point in terms of that integration yet.
Thanks very much, Daff. Thank you. Question, one of the other questions is this paid for or endorsed by NHS England and NHS Digital as a tool for the GP?
Should I take that? So in terms of requirements, so we've been through the DSPT, so the Data Security Protection Toolkit process. All the standards are met in terms of that process. So it's not formally approved, as it were, in terms of NHS Digital, but all the standards have been met. So there's a very small number of things that NHS Digital formally approve, and their usual approach to this stuff is that they kind of set the standards and make sure you meet those standards.
Great, thanks very much. And before we just take the last one, if anyone's got any final questions, the question box looks like this. It's here on my screen, but it is, I think, up in the top right for those that are our participants. So if there's any burning final questions, then please feel free to ask them. But the last question I've got here is, has Concentric ever been used to gain consent for participation in research studies? If so, how is the data transferred of that consent handled between this tool and the study team?
So the answer is we haven't been used for study-specific research consent yet. We may do in the future, but right now our focus is on ensuring we really get the clinical consent right. So we can point to other research consent information. So at Imperial, the oncologists want us to be signposting to research studies, and we can digitally link in certain operations or procedures or chemotherapy regimes to certain trials, and then that will link digitally to that trial PDF, or we can print that off. But we're not taking over that process at the moment.
Great, thanks very much. That seems to be all the questions that have come through during the session.
There's one I can see about other examples of this being used in primary care. And the answer is not yet, but we're in discussions with some people already, and we're very keen to start being used in primary care. So I think if you're interested, please reach out to us. Best is probably to contact DAF directly, by all means, me as well, but DAF can be reached on daf@concentric.health.
Fantastic, thanks so much.
And if that's, is that all? If anyone's got any other questions, very happy to answer them. Otherwise, we'll let you, I know lunch is short, we'll let you finish off your sandwich.
So, yeah, thank you very much.
So at this point, I'm going to drop off, but maybe if Ed, you stay on the call just for 5 minutes in case any questions come through. Great, thanks all.
So I'm happy to stay on for another minute, but watching me wait may not be the most fun. So I'll just give it one more minute and then I think we'll wrap it up. But if this has prompted any questions for you that you'd like to ask either DAF or me personally, if you just go to www.concentric.health, you'll find our website and our contact details on there. That's probably the easiest. I can be reached at edward@concentric.health. Very, very happy to answer any questions and explain how we're working. And as DAF, I think, alluded to, over the last several weeks, we've had really an increasing number of people speaking to us about starting to use, and we've already gone live in 5 sites, and we're about to go live in a number of other trusts in the next week, and it's growing pretty rapidly. So very keen to support. We're very small but working hard team, ambitious to help everyone with this. So I can't see any more questions come through. So I think that's probably time to leave it at that. So thank you very much for your time, and do get in touch if you want to know anything more. Thank you.
Thanks, Edward. Thank you.